It's lifting the lid. Sanders, good to see you.
Good afternoon, everyone. Welcome to the Joint Government Operations Committee Rule Review meeting. We are right now called to order for April the 29th of 2026. Clerk, please take the roll.
All right, Senator Bowling. Senator Bowling present. Senator Crow. Senator Crow present. Senator Hatcher. Senator Hatcher present. Senator Kyle. Senator Kyle present. Senator Oliver. Senator Oliver present. Senator Rose. Senator Rose present. Senator Seal. Senator Seal present. Senator Sutherland. Senator Sutherland present. Chairman Jackson. Chairman Jackson present. You have 9 present. You have a quorum.
And for the House, please.
You have Representative Camper, Representative Clemens, Representative Crawford, Representative Faison, Representative Faison present, Representative Fritz, Representative Fritz present, Representative Glenn present, Representative Haynes present, Representative Mayberry present, Representative McKenzie present, Representative Parkinson present, Representative Reedy present, Representative Renault present, Representative Sherrill present, Representative Rutter present, Representative Towns, and Chairman Lafferty.
I'm here.
Chairman Lafferty present. You have 12 present. You have a quorum.
All right, thank you for that. Members, before we get started with business today, I know there are some personal orders. Representative Faison, you're recognized, sir.
Thank you, Mr. Chair. And Mr. Chair, I'm sure there will be several who want to say something after me, but I want to recognize a dear friend of ours that is not here today. And Representative G.A. Hardaway, I'll tell you all a quick story. In 2014, Speaker Harwell probably foolishly decided to put me as chair of this committee. And the first 4 years of my legislature, G.A. and I would pass each other in the hall, say hey, and exchange pleasantries, but I never got to know G.A. at all. And we'd never served on the committee together, so I didn't know how he was in committee. And so I chairing GovOps and thinking I'm somebody. I've only been here for a few years, and you're a little bit on the cocky side when you get that gavel the first time. And third or fourth weekend, GA, and if y'all remember, you served with him, he had as a question or a thought about everything. And at times, you're like, good gracious, you really have to speak, GA, Well, I ignored him one time. And afterwards, he came up to me. And he said, Jeremy, I know you're in the majority here, but I deserve to speak. And you ignored me on purpose. And I said, man, it's rough to be in the minority, kind of poking at him. And he said, Jeremy, do you know why we have rules in the House of Representatives? And it kind of caught me off guard. I was like, well, GA, I guess so we keep decorum. He said, no, we have rules so that whoever's in the majority can't squish whoever's in the minority. And those rules guarantee a voice for everybody in here, no matter how big or small your party is. And Jeremy, the pendulum of politics swings, and one day you're going to be in the minority. And do you want somebody to treat you the way you treated me today? That started a close friendship of he and I, and we became very good buddies. I've been to his place in Nashville, been to his district, had breakfast with him in his district, and he was a beautiful soul that cared about fairness and taught me a profound lesson up here that we can all learn from. And I just want to give a shout out to him and say that the state of Tennessee is better, Memphis is better because of his service. Thank you, Mr. Chair.
Thank you for that. And I think next I've got Representative Parkinson.
Thank you, Mr. Chair. It's no secret that myself and State Rep G.A. Hardaway used to have our bouts and our rounds, up here at the Tennessee legislature. But when I got here, he was a mentor to me. We used to actually be desk mates, and And one of the things that would happen every now and then is Speaker Harwell would be calling on me, and she'd say, Representative Hardaway, you're recognized. And I'd be like, Speaker Williams, I'm Representative Parkinson. And we'd all get a chuckle out of that because, you know, she used to always mix us up, mix our names up. And then there's a certain chairman that would do the same thing, right? But I'm not going to call any names, right? And, you know, but, you know, his last words to me, this is something that not many people know. A few weeks ago, as a matter of fact, it was when this famous guy right here was running his famous bill, one of his last famous bills that, you know, was interesting to me. And his remorse bill. And we were leaving the chamber. I had spoke on the bill and spoke on another bill. We're leaving the chamber, and he was riding on the scooter at the time, and I was walking beside him. We were trying to get to the elevator fast. And and he told me on that day, he looked up at me as we were trying to get to the elevator, and he said, young man, I'm proud of you. And so that was a shocker to me, first of all. I was like, what? Who said that? Where'd that come from? And then he said it again. I just want you to know that I'm proud of you. And me being the jokester that I am, I said, okay, I know somebody's recording this. Anybody capturing this moment? Because this is history in the making, right? But he was sincere with what he said. He meant every word of it. I didn't know if it was because I was standing up talking about Chairman Faison's bill, or if it was just in general, or if it was, you know, what it was for. But we have a long history together. You know, years before I was elected, actually, years before he was elected, we've been knowing each other. So, you know, his family, and regardless of, you know, any, you know, tussles that we may have had, he's still family. Always will be family, and he'll be sorely missed, and his voice would be sorely missed here in the state of Tennessee. So thank you, Mr. Chairman.
Thank you for those kind words. Representative McKenzie?
Thank you, Mr. Chair. And I won't be long, but just really quickly, you know, I had a pretty hotly contested race in the primary, and I won it by 23 votes. And probably the second person that called me was this name that I saw and, you know, seen and gone through the process, and that was the G.A. Hardaway. I don't know how he got my number or anything, but he called, and I was like, you know, Rep. Hardaway, I hadn't won yet. There's a general. He's like, you're going to win, and this is what I want. And just immediately started tasking me with things, because he was the chair of the Black Caucus at the time. And we just had a brief conversation, but it really set me in the right direction in terms of process. We talked a lot about me needing to understand the process of and how to be a representative and how to introduce things. And this is, you know, again, all just new to me. I'm just a wide-eyed person, happy to barely won his race. And you know, this was during COVID. So he talked, as you know, he wore his mask longer than anyone in this building. And he would put it on occasion, even this session. But I just, you know, it's his death has affected me deeper than I initially thought it would. But it's just because of who he was and how he carried himself. He would speak the truth to whatever audience, whichever audience needed to hear it. He would do it. So just want to say a few words. Thank you, Mr. Chair.
Thank you for that. Next up, we've got Senator Crow.
Thank you, Mr. Chair. You know, you don't realize sometimes just how much you're going to miss somebody till they're gone. GA was one of those guys. He read everything. He commented on everything. And he really, you know, I can't tell you how many times I've thought to myself, well, maybe I should say something on this one, and I didn't, and then GA would. You know what I mean? So I really am going to miss him. He was a good man and cared about the people he served very much. And I'm going to miss him. You don't realize how much sometimes till they're gone. Yep.
Senator Boland.
I kind of carry along with what Senator Crow just said. GA was a friend. And one of the really fun times we had, which sounds like it's a strange thing to have a fun time, but it was down in Marion County in Whitwell at the Holocaust Museum. Now, a lot of people might not realize in Tennessee, we have one of the largest collections of items from the Holocaust east of the Mississippi. It is a wonderful museum. If you've not been there, go. And I was serving Marion County at the time, and I had invited a group of legislators to come down and tour the Holocaust Museum with us, and GA was one of them. And GA really was impressed with all that was there and with what had taken place for the Jewish people around the world during the Holocaust. And he wanted us to even do more. What else can we do? And I said, this is a pretty significant museum right here, and we need to let people know so that they do come down and tour it and take advantage of it. But GA was just a friend, and he was there and so fastidious in everything he did. And when he invited me to his office one time, how many of you ever went to GA's office? It was kind of the opposite of GA. Am I lying? I'm telling the truth. But he had a great big jar of peanuts that he was very willing to share. And so, but I was so tickled because his office was the opposite of him. And he was just a friend, and he was always there. And he didn't change regardless of what we were going through as caucuses or what subjects were going on. We were able to communicate and talk to each other. And I definitely was shocked to learn of his passing and saddened. At the same time, he's not lost. We know where he is. And that's the blessing. That's the blessing.
Thank you, Senator. Senator Kyle, you're recognized.
Thank you, Chairman. Thank you for allowing us to have these moments. We all love GA. Here's a few things I do want people to know about him. Such a gentleman, always a gentleman. GA grew up in a loving household. He went to private church school, private school. His father was known as an educational icon in Shelby County. GA ends up at Christian Brothers University. I don't think they would have accepted my application. I just didn't have that high intelligence. GA was very, very intelligent. And when I got up here, I had a very close friend, Representative Bill Beck. He said, now, Sarah, do you Memphis people just talk a long time? I said, I want you to go back down there, and I want you to listen to GA. He's one of the most intelligent people that you will ever get to listen to. And sure enough, Beck came back up and he said, you're right. He's very intelligent. I said, yeah, you all just think we're like Baptist ministers and talk too long, but we do have a lot to say. I want to remember too right now, or acknowledge, GA all his life had a group. There was 4 of them. The 2 that I know besides GA was Gail Jones Carson, Deidre Malone. These people knew each other since high school. They have leaned on each other. They have been the fabric of each other's lives, all different directions, all turned out to be great leaders. And I just want you to know the type of man he was, the friendships he had, and the gentleman he was, not only to me. I always saw I got to my car if I was at an event. He was our friend, and today we're wearing even homemade bow ties in his honor. We will never forget him, but I just want us all to celebrate that we got to share some history with the great Representative G.A. Hardaway.
Thank you for those kind words. Leader Camper.
Thank you, Chairman, members. I was sitting here thinking about, what would I say about Hardaway? I guess the first thing I'd say is that people have been calling from across, not just across the world, but internationally. When he was with NBCSL, he was the chair of the international relations. So everybody is expressing their heartfelt condolences for him. And that he was everybody's best friend. You ask anybody in Memphis, oh yeah, you're my best friend. So everybody really love him because of his contribution to our city, our state, our country. And lastly, I'll say, everybody worked for him. He make you do all kind of stuff. I need you to, Casey, GA, I don't really work for you. But okay, when you finish, you like, okay, you need to go do this. But we all enjoyed doing it for him. We all enjoyed working I worked in his very first campaign when he was running a special election for the House seat. And, he was a very hard worker. He believed in what he did. And we all know that, but just for those streaming and watching, it's a true friend to everybody. I mean, he just loved people. He loved our city, our county, our state, and our country. So I'll stop there, Mr. Chairman.
Thank you, Leader Camper. Representative Towns.
Mr. Chairman and members, thank you for an opportunity to address the body in such a solemn, somber occasion where one of the members of our flock has been peeled off and transitioned into another realm of existence, as I would say. I've had the good fortune of knowing GA for 52 years. We were young boys together, bright-eyed and dreams and things that we wanted to do. And that's a long time, 52 years. And our encounter was, he was active in the community. We were at the university. He was active in the community at that point in time. He had not had his children. He has 3 children, one of which is an attorney who used to work here. Now, back and forth, I think, into D.C. as an attorney. He loved his kids. You got to understand this guy, how he loved his kids. He loved his family. This is pre-elected GA. He was a family man at his core. Holidays, we'd be at his house hanging out, having a great time with his wife and the kids. Kids so small, you thump them on the head. You know, back in the old guys, you thump you on your head like that right there. Kids were that young. Now they're grown. They're here. We'll see them tomorrow. But at that time, he was still so conscientious, and I didn't understand at that time that his parents were educators. And he exhibited that everywhere he went. As Senator Kyl stated, he was a consummate gentleman. As the folk that encountered him knew he was just that way. It was not fraud, front, pretend. It was just how he was. That's a part of his being, his character. And but he was always active and concerned about improving the community. A lot of fun. We had a lot of fun together. United is when you got guys together and girls together, your buddies, you have a lot of fun. And we were responsible for a lot of things that transitioned Memphis in a good way over the years. When he wasn't elected, he would ask and give you work, as Leader Camper said. He had plenty of work for the elected officials to do. I said, man, you need to run. He's working me to death. He ran and he won and tried to make a contribution. As you've already indicated, he's well-read, very well-read, and could express that in a way that all could understand it. He would take his time and do it. He also had a lot of courage. He wasn't a big man. He was not a big man, but he had a lot of courage. I remember one day we were in the House side and we were having our little confrontation, down toward the end of the session. And there was a vote that we needed a certain amount of members to vote, and the members on the other Democratic side decided we're going to walk out. So somebody got word of it, and they tried to lock the back door. GA organized us, and we bust through the back door. We bust through the state troopers and all, because they never saw it coming. He was a courageous rascal Now, he had the big head. His name is GA. Y'all know what the first of that means? He thought it meant General Assembly. I told him something else. But what it was, he could be certainly an exemplary person to represent the General Assembly. His first name, y'all don't know, is Godfrey. That's his name, Godfrey. Godfrey Hardaway, Sr. All of us have had an opportunity to touch this young man, have had the treasure of meeting a great human being in life, and we need more encounters like that. And another thing about him and this body, he didn't hold grudges. Once it was over, it was over. We moving on. He did not hold grudges, but he was a good man, great representative, and we're just so grateful to have had an opportunity for a little bit of God's time to spend a little bit of that time with him. May he continue to be blessed, his family as well. Thank you, Mr. Chairman.
Thank you, Representative Towns. Representative Fritz, you're recognized.
Thank you, Mr. Chairman. Just quickly, I think of GA, and we were doing our restructuring the State Energy Policy Council, and I talked to him about a couple things, and his resounding comment was, make sure the folks in West Tennessee are represented on that. So that's a noteworthy thing to say, and I wanted to make sure that was heard.
Thank you for that. Members, any other comments about our friend? If we could, just a moment of silence for his family and people that know him and love him. Thank you all. Not a fun start, but a warm start to the day. All right. Moving on. Members, public gathering, those who've come to see us today. We've got a sign-up sheet up front for anybody that's interested in making any comments on any of the rules that we have before us today. Please make sure and get your name on the sheet. First up, item number 1 on our agenda today, we've got the Department of Environment and Conservation. If you would come on down, please. When you are seated, if you would please introduce yourself, tell us who you're with, and tell us about your rules.
Good afternoon, Chairman and Committee. My name is Emma Ousley, and I'm the Assistant Director of Legislation at TDEC. With me today, I have Mr. Todd Crabtree, the State Botanist with our Division of Natural Areas. TDEC's Division of State Natural Areas is performing a routine update to our rules concerning endangered plant species in Tennessee. This update occurs every 3 years and is led by an advisory committee of 12 botanists from across the state. This particular update adds 12 new plants to the list, as well as corrects the scientific names of other plants on the list. We did have one public comment that was received during the public comment period. The commentator noted that the endangered plants, Woods sedge and John Beck's leaf cup, should be included on the list. We agreed and added that to the list. We respectfully request a positive recommendation on this rule and welcome any questions that you may have. Thank you.
Appreciate that explanation. Members, do we have any questions? Senator Hatcher, you recognize, sir.
Thank you, Mr. Chairman. I just have a couple of questions. Can you tell me exactly how many plants are on the endangered species list?
You recognize.
I will throw that question to Todd.
And sir, if you would please introduce yourself.
I'm Todd Crabtree, state botanist, and I do not have that number in my head right now. I can get the exact number to you later, but it is somewhere around 40, 50, 60. I'm not sure.
If you all would like, I'm happy to sit here and count them out for you and then get you an answer right now.
Senator Hatcher.
One follow-up. I mean, if that's what you want to do with that, can you name all the plant species on the list and the county they are located in? And can you reference the Latin name and the corresponding common name?
There's clearly a game afoot here. No, I can do that. She'll send us an email.
Mr. Chairman, I'll withdraw that question.
All right. Thank you, sir. Representative Towns, you're recognized.
Thank you, sir. Thank you. When plants are determined to be endangered or being, annihilated in our communities, once we identify them, what do we do to nurture them back or grow their numbers?
You recognized.
So the primary effect is when we're acquiring public lands. So we do things to protect plants, and this is part of the process to prioritize those. So it's endangered. That's our priority, again, when we're looking at acquiring public lands. So if that shows up somewhere, and we have a willing landowner, and there's more than just one plant usually, we will move to try to acquire that, to protect it. These also show up in environmental reviews. And all that means is there's a discussion of, could it be there? Do we have existing records? And then the conversation goes to, can it be easily avoided? Do we need to move it? What needs to happen in that situation? And if you are, if you have a project and we review it, we will give you advice on this plant. And if it's found, somebody finds that, what can be done or what should be done or what we would like to be done.
Okay, Mr. Chairman.
You're recognized.
Is there a seed bank of sorts that we have for these plants and that are fading? And also whether or not there are any food seeds or food plants that are becoming extinct as well?
You're recognized.
So we don't have endangered plants that are of economic value in Tennessee.
Not economic,
So
food.
Well, these are all just rare. That's the only criteria. Is it rare? Is it not rare?
Okay.
And then we try to protect what we can.
To a seed bank? Do we have a seed bank?
We don't have a seed bank in
Okay.
Tennessee other than at Clarksville,
Okay.
at Austin Peay State University, the Strategic Grasslands Initiative is acquiring seeds to use in restoration projects.
Mhm.
So they're looking at people with large tracts of land that want to restore grasslands. So they are storing some seeds. And there's other places around the country that we work with, Missouri Botanical Gardens, Atlanta Botanical Gardens, and most of our federally listed species have that.
All right.
They're
Mr. Chairman,
there.
thank you. Thank you, sir.
Yes, sir. Senator Seal, you're recognized.
Thank you, Mr. Chairman. Sedge in Claiborne County, that's one of the counties that I represent. You may not know the answer to this question, but where in the county is that found?
It's in the Ridge and Valley, I've been to the site, so I know where it is. They're rare, so there's not that many sites. And I've usually been to at least one site for these rare endangered species. It's right beside a roadside. There may be more than one site, but these are seeps in those steep coves that lead down to the rivers. And one of them is right beside a roadside. And we just made contact late last year with the landowner. And we're working to acquire that site, which has some other rare plants on it. So it's not just everywhere.
You're recognized.
So you mentioned landowners. By putting that on this list, does that affect the private property owners' rights in any way?
In Tennessee, landowners own the plants.
Okay.
If they wanted to make a wreath out of it, they could. There's no. But if someone comes onto their land and takes that endangered plant, that's when the Rare Plant Act goes into effect. So there's some recourse for the landowner on that loss.
Follow up?
And out of the 12 that are on this list, I don't see kudzu on there. Is there a reason why? Thank you, Mr. Chairman.
Yes, sir. Senator Hatcher?
One quick follow-up to what Jesse said. Did any plants come off the endangered species list?
Not this time. 2 years ago, we had some come off of the list. And that's part of the review process at our Scientific Advisory Committee meeting. We look at those things. So none this time.
Follow up?
Do you know which ones come off?
2 years ago, I cannot recall. I don't have that with me right now.
We can get that information to
We can
you.
get that, yeah.
Thank you.
All right, thank you. Members, any other questions? Representative Fritz.
Thank you, Mr. Chairman. First, thank you for your time and knowledge about the subject matter. As we two questions, and I'll ask them quickly so you can answer and we can move on. How do we update to determine what plants are added to this? And secondly, second question, we hear in Ag Committee about the use of herbicides in our forested land. Are we aware of any negative impact from the use of those herbicides in Tennessee-owned forested land that may be impacting the growth of at-risk species of plants?
For updating this, which is required by law that we evaluate this list every 3 years, at least every 3 years, we have a rare plant committee. And any interested party can make proposals to changes in the status of species on this list. So that's where it starts. And then we have a meeting, and we have a good representation of expertise in Tennessee and sometimes people that used to work in Tennessee. And we evaluate each proposal. And that doesn't just involve endangered, but other status on our list. And once that's decided, if somebody said, okay, I want to add an endangered species, then we start this process. So the second part of your question, which you're going to have to remind me.
Go ahead.
Thank you, Mr. Chairman. I apologize. Thank you. In agriculture hearings, we're often, we talk about the state using herbicides to control what's in the forested areas of state property. Are we seeing any negative impact of those different species of plants by the use of those herbicides?
So the greatest intersection of herbicides and rare plants in Tennessee is on power line right-of-ways. And most of those rare plants are not woody plants, and what they're controlling is woody plants. Having said that, we work with TVA primarily. They have our data. They know where our rare plant locations are. And for example, in Coffee County, there's a lot of rare plants, and they know where those are. And instead of flying a helicopter over, they have crews on the ground spot treating those woody plants. And that's taken years to get to that point to understand, okay, that's what we have to do to protect these plants.
Follow up?
Just one quick follow-up. Thank you, Mr. Chairman. So could be a misunderstanding on my part. I understood that our State Department of Forestry was using some of the herbicides to control plant life in state land, not TVA and lines. And is there a coordination with the Department of Forestry on what we use to protect these plants?
We review projects on the state forest. They have blocks where they're going to harvest or widen the road or whatever, and our division reviews those. And if we've got rare plants in there, we'll comment and say, you should avoid this or whatever.
Thank you.
Yes, sir. Thank you for that. I'm curious, you mentioned a second ago that when you do come across a situation where a plant might be endangered, you try to acquire land. And then you also mentioned that the landowner still has full rights to the property. Could you explain that a little bit farther for me, please?
So to acquire property, we have to have a willing landowner. And if it's a private landowner and it's not public land, they still can do whatever they want to with an endangered plant on their property.
Okay, so you're just, when you say acquire, you don't mean like taking physical ownership of a deeded piece of property. You mean they've given you permission to oversee the property? I'm still a little confused, I guess.
There's some different mechanisms, but if we're going to acquire it, it's a simple purchase.
Okay,
And that's like if you had land that you were maybe not interested in selling it, but I came by and said, hey, looks like you're not doing anything with this. I'd like to buy your land. It's the same process.
okay.
And it's not exactly the same because the state, as you may know, can't just negotiate prices on land. We have some restrictions on how much we can pay.
Okay. And roughly how many acres of land would you say that Environment Conservation has under ownership?
I think we might have to get back to you on that one, but I'm happy to look into it and send you a follow-up.
Yeah, please, that'd be appreciated. Okay, members, any other questions? Representative Parkinson.
Thank you, Mr. Chair. Is cannabis on that list?
I don't believe so, no.
No,
Not rare.
Why not?
I believe if it's not on the list, it's not considered rare or endangered.
Oh, okay, so it's plentiful.
These are native.
Okay, okay. Thank you,
These are
Ms.
native plants.
Yeah, thank you, Mr. Chair.
Native to Tennessee.
All right. I think now that we've got that out, members, we're ready to vote. We've got a motion, a second for a positive recommendation. All those in the House, I'm sorry. All those in the House in favor of positive recommendation indicate by saying aye. Any opposed? Ayes have it in the House. And on to the Senate. Mr. Clerk, if you would take the vote in the Senate.
Senator Bowling. Senator Bowling votes aye. Senator Crowe. Senator Crowe votes aye. Senator Hatcher.
Aye.
Senator Hatcher votes aye. Senator Kyle. Senator Kyle votes aye. Senator Oliver. Senator Oliver votes aye. Senator Rose. Senator Rose votes aye. Senator Seal. Senator Seal votes aye. Senator Sutherland. Senator Sutherland, votes aye. And Chairman Jackson. Chairman Jackson votes aye. You have 9 ayes, 0 nays.
Thank you for that. And the rule moves out with positive recommendation.
Thank
you
you,
guys for
Chairman
being
and
up here
committee.
today. Next up on our list, item number 2, we've got the Department of State. When you're ready, please introduce yourself for the record, who you're with, and tell us about the rules.
Good afternoon, Chairman and members of the committee. My name is Mallory Donovan. I'm the Legislative and Agency Affairs Coordinator for the Secretary of State. And with me today is Janet Kleinfelter. She's our Director of Business and Charitable Organizations and Special Counsel for the Secretary of State. State law authorizes the Secretary of State's Division of Business and Charitable Organizations to charge fees for certain databases available for purchase. These fees reflect what is currently being charged pursuant to policy. This rule simply places those existing fees into rule. Last year, we reviewed our fee schedules and found that our fees are consistent with what other states charge for similar databases. And in some instances, we are on the low end. At this time, we have no plans to increase our fees and believe it's appropriate for the Government Operations Committee to review any future changes. I'm happy to answer any questions.
Thank you for that explanation. Members, do we have any questions? Just one for me then. Is there on the webpage, I know you guys try to protect that information and make sure that it's only used for its intended purposes. Is there indications on the webpage if someone thinks that information is being misused? Is there a way for them to get hold of you and report that?
Good afternoon, Janet Kleinfelter, Director of Business and Charitable Organizations. There is the ability to file a complaint with our office if you believe that your information is being used inappropriately. And then, of course, last year, this body, the legislature passed the unauthorized filings provision, which allows an individual to file a complaint with our office. And we pursue an administrative process to ultimately void that filing if it's determined that somebody's information was used without their consent.
Thank you for that explanation. Senator Hatcher, you're recognized.
Thank you, Mr. Chairman. Is there any kind of physical impact on local governments with this?
No, this doesn't affect local governments at all. This is our databases based upon information. The records that are filed with our office, the information is culled and put into the databases, made available for the public. Any local government that is asking for information from us, we provide that information without cost.
Okay, thank you.
Yes, sir. Senator Seal, you're recognized.
Thank you, Mr. Speaker. I do not, Mr. Chairman, sorry, I do not have a question, rather a comment. One of the number one complaints my office gets is state departments and how they get back to them. So I want to give y'all some kudos this afternoon. You all answer the phone. It's not a pre-recording, and I want to say thank you, and you help direct people to the right places. So the Secretary does a good job, and I know that you're following his direction and doing that. And I just wanted to say thank you so much for that.
We appreciate those comments. I have a very dedicated staff that stays on the phone and answers the phone from 8 to 4:30 and sometimes past 4:30, 5 days a week. So I very much appreciate those comments.
Thank you for that. Members, any other questions? Seeing none, can I get a recommendation for? I'm sorry, was there any public comment on this rule?
No.
All right, seeing none. So do we have a motion for a positive recommendation? We've got a motion and a second. Madam Clerk, if you would, please take the vote in the Senate.
Senator Bowling. Senator Bowling votes aye. Senator Crow. Senator Crow votes aye. Senator Hatcher. Senator Hatcher votes aye. Senator Kyle. Senator Kyle votes aye. Senator Oliver. Senator Oliver votes aye. Senator Rose. Senator Rose votes aye. Senator Seal. Senator Seal votes aye. Senator Sutherland. Senator Sutherland votes aye. And Chairman Jackson. Chairman Jackson votes aye. You have 9 ayes.
Thank you for that. And members to the House, all those in favor of positive recommendation, please indicate by saying aye. Any opposed? Ayes have it. Rule moves out with positive recommendation. Thank you, ladies, for being here.
Thank you.
Next up on our agenda, item number 3, the Department of Mental Health and Substance Abuse Services. When you are situated and ready, please introduce yourself and tell us who you're with for the record, and let us know about your rule.
Thank you, Chairman and committee members. My name is Kristen Beloff. I'm with the Department of Mental Health and Substance Abuse Services. To my left is Alex King, the department's Assistant Commissioner of Administrative and Regulatory Services. And to Alex's left is Dan Giannotti, the Director of Licensure. The rules before you pertain to chapters 940-5-4 and 940-5-6, which cover life safety requirements and outline minimum program requirements for all licensed services and facilities. The revised rules update outdated language, align them with current safety standards and best practices, and provide a framework for providers who want the option to allow parents and or guardians to reside with their children while in certain residential treatment settings. After a robust review process during which the department held a rulemaking hearing and solicited feedback from the public and providers, the department presents these rules to you today for consideration and a positive recommendation, and we're happy to answer any questions you may have.
Thanks for that explanation. Representative Fritz, you're recognized.
Mr. Chairman, thank you for your time today. My first question is on 0404, the first item, and it's just a question of curiosity. We added in alcohol and drug outpatient detox facilities, and just curious why we didn't consider a methadone non-resident facility as one of those type. They're called out separately, and just curious as to why that is.
Yes, Representative, thank you for the question. Alex King, Assistant Commissioner of Administrative and Regulatory Services. These rules specifically relate to residential settings. Methadone is exclusive to non-residential settings.
Follow up?
Thank you so much. I understand it's all listed under business occupancies, and so that confused me a little bit that they may be in the same category, but I understand your answer. My next one is on, it's actually on page 38, if that helps some, and it's under 050406, item number 17. And so it talks about licensure approval via waiver request for multiple occupancy, and there's not really a limit on that, so just who would that mean?
Sorry, this is Dan Giannotti, Director of Licensure for Tennessee Department of Mental Health. And so your question, if you could clarify for me, please, one time.
Oh, yes, sir. I apologize. So item number 17, it talks about facilities where minors are residing with parents or guardians. And then it goes on down to say that licensure approval via a waiver request for multiple occupancy if they believe their arrangement justifies such a scenario. Who is there a limit on who that could be in that waiver?
So it's intended for the parents or guardians and their minor children, but if it's structured in a way where there's going to be multiple people going in there other than just say a mother and a child, they would send in a waiver request so we can make sure that everything fits the rules as they should.
Thank you, Mr. Chairman.
Yes, sir. Next up, Representative Glenn.
Thank you, Mr. Chairman, and thank you all for being here. My question is, this is allowing kids to reside with the parent when they're going through treatment. Is there a level to that? I mean, I'm sure you're not letting kids in there if the parent is in a really, really bad state. So how does that work?
Yeah, sure. Thank you for that question. Again, Stan Giannotti, the Director of Licensure. What it is kind of like one of the lower levels of, say, for lack of a better term, of treatment. So it's not like the severe, lockdown facility or anything like that. It's more of a residential type setting.
Follow up?
Thank you, Mr. Chairman. And also in there, it talks about, I forgot my question. I'll come back.
All right, we'll keep an eye out for you. Just put your hand up when you're ready. Representative Frisk, did you have a follow-up?
I did, Mr. Chairman. I apologize. Thank you so much. And I appreciate your all's patience with me. So on page 46, and I can give you the number in a minute, but it refers to, you'll know what this is, that persons, the change is persons on the sexual offender registry or sex offender registry and Tennessee's vulnerable adult abuse registry. And so just in reference to that, how many employees or how many volunteers rather do we have that fall on those registries?
That are actually on the registries themselves.
Yes.
We don't maintain those registries at the Department of Mental Health. Those are typically Department of Health. I don't know off the top of my head what those numbers are of how many people are on those registries, but we'd be happy to look that up and get numbers if we could get that for you.
Follow up?
So when I read this, and perhaps I'm mistaken, but I read that to mean that these are people who are volunteering to help in our facilities that are on these registries. Is that the case?
Yeah, to clarify for you, Representative, so what that section is talking about is if you're on those registries, you cannot work or volunteer in these settings whatsoever.
Okay.
And just to further follow up, that is, we put that in there to make sure all the registries were captured because.
Thank you.
All right, yes, sir. Representative Glenn.
Thank you, Mr. Chairman. My old age must be kicking in. I finally remembered my question.
You're not alone.
In here, it talks a little bit about space, right? So if a parent comes in and they have 3 kids, this does not allow for them to bring all 3 kids in, right? It only allows if they have a newborn, is what I'm assuming. Is that kind of where
to
it's
answer your
at?
question, no, it doesn't. It's newborn up through 18 years old.
Follow up?
But if they have more than one,
Yes, they could. And so they would have to let us know what their structure looks like so we could see it ahead of time and make sure that it could meet it. So if you have a newborn, if they had twins, they could have both of those in there. But those kids would not count towards the square footage requirements.
okay, thank you.
All right. And kind of along those lines, what, when the kids do come to stay, who absorbs that extra expense? Is that picked up by insurance? Is that something that the state takes care of?
So that would be, so these is not a requirement for facilities to have to do this. They don't have to allow that. That's up to their choice and the patient's choice if they want to allow that to happen. And so from the department's perspective, the state's perspective, there's no cost driven from us of requirement that is all optional, and the facility would absorb that and work that out with the patient before they began treatment and resided there.
Okay, thank you. And I can't find it just on the fly, but I've got a note here. Somewhere I read that there was an idea or a thought that somehow the private sector could potentially profit from this. Could you elaborate, or do I need to go back and find my source here?
Yeah, obviously, so these rules relate to facilities that we license, many of which are private organizations that are providing mental health or substance abuse treatment. So from a profitability standpoint, it would really look to their payer relationships, whether that be private pay or insurance agreements, and whatever negotiations or agreements they come to on if you bring a child in that is with that parent or with that guardian, does that equate to a higher reimbursement rate or something? That has nothing to do with what we're establishing here. That would be a private relationship between that organization and the payer.
All right, thanks for clarifying. Any other questions? Seeing none, can I get a motion? Got a motion? Oh, I'm sorry, is there any public comment? I keep forgetting that part. All right, seeing no public comment, we've got a motion for a positive recommendation and a second. Madam Clerk, if you would please take the roll in the Senate.
Senator Bowling? Senator Bowling votes aye. Senator Crow? Senator Crow votes aye. Senator Hatcher? Senator Hatcher votes aye. Senator Kyle? Senator Kyle votes aye. Senator Oliver? Senator Oliver votes aye. Senator Rose? Senator Rose votes aye. Senator Seal. Senator Seal votes aye. Senator Sutherland. Senator Sutherland votes aye. Chairman Jackson. Chairman Jackson votes aye. You have 9 ayes.
Thank you for that. Then on to the House members. All in favor indicate by saying aye. Any opposed? Ayes have it. Rule moves out with positive recommendation. Thank you guys for being up here
Thank you,
today.
Chairman and committee members.
Yes, ma'am. Next up, item number 4, we have the Board of Medical Examiners. The polysomnography, I just like saying that. When you're ready, you're recognized, and you know how it works, I think. Introduce yourself for the record. Tell us who you're with.
Good afternoon, Chairman, members of committee. My name is Olivia Johnson. I'm a legislative liaison for Department of Health. I'm joined by Charity Warwick, board member, and Ashley Fine, Office of General Counsel. Today, the Polysomnography Professional Standards Committee is before you for their rule. Polysomnography professionals the Professionals Standards Committee regulates healthcare experts who conduct sleep studies to diagnose and treat sleep disorders such as apnea or narcolepsy. The board voted to amend Rule 0880-14-.06 regarding retirement and reinstatement. Under the current rules, a formally licensed polysomnographer professional would have to complete 10 hours of continued education for every year that they were retired, and those hours would have to be completed within 6 months of reinstatement. So, for example, under the current rules, if a licensee was retired for 4 years and was seeking reinstatement, they would have to complete 40 hours of continuing education within 6 months of reinstatement. The board felt that this was too onerous and not necessary to protect the public, so they are proposing to change these rules that would cap continuing education hours to 20 hours and give the applicant 12 months to complete those hours. All board members and present voted in favor of this rule change, and there was no public comment submitted for this. At this time, we're happy to answer any questions you may have.
Thanks for the explanation. Members, do we have any questions for our guest? Oh, Representative McKenzie, you're recognized, sir.
Thank you, Mr. Chair. So in terms of what that 20 hours consists of, does it focus on evolution in the industry since they retired? So I would hate for someone to been out for, 6, 7 years and things have evolved. So is that the focus? Because it just says continuing education. It doesn't clarify what that is.
This is Ashley Fine. I can, as attorney for the board, the continuing education rule has various things that qualify within the realm of continuing education. And anything within that rule is something that the licensee could or the applicant could take in terms of being considered for these 20 hours.
Follow up?
Just as a follow-up, just, as I think about it, as technology advances, if they chose basically to get retrained on something that they know that they may be behind, I would ask y'all to consider making sure that that continuing education is relevant to the industry evolution since they retired, because they probably haven't kept up. But thank you, Mr. Chair.
Yes, sir. Members, any other questions for our guest? Seeing none. Can I get a recommendation? Oh, I'm sorry, public comment. I will get that before the day's out. All right, we've got a motion and a second for a positive recommendation. Madam Clerk, would you please go ahead and take the vote in the Senate?
Senator Bowling. Senator Bowling votes aye. Senator Crow. Senator Crow votes aye. Senator Hatcher. Senator Hatcher votes aye. Senator Kyle. Senator Kyle votes aye. Senator Oliver. Senator Rose. Senator Rose votes aye. Senator Seal. Senator Seal votes aye. Senator Sutherland. Chairman Jackson. All right, you have 7. Yep, 7 ayes. You have 7 ayes.
Thank you for that. Now on to the House. Members, all in favor of positive recommendation indicate by saying aye. Any opposed? The ayes have it. Rules move out with positive recommendation. Thank you, ladies.
Thank you.
Next up, we have item number 5. But before we get started, do we have any public comment? Just warming up here. All right. You guys come on down. If you would, please introduce yourself for the record. Tell us who you're with.
Thank you, Chairman and Committee. My name is Katie Thomas. I am with the Health Facilities Commission. With me is Scott Farragher. He is our rules attorney. In 2024, the General Assembly passed Public Chapter 985, sponsored by Representative Boyd and Senator Reeves. This legislation removed the CON requirement for burn units neonatal intensive care units, MRI machines, and PET units. The law requires a license to establish or conduct such facilities and services effective December 1st, 2025. TCA 6811-1607 QT states that a person providing PET or MRI services is subject to licensure sanction under TCA 6811-207 as a violation of Part 2 of Chapter 11 in Title 68, or the rules, regulations, or minimum standards issued pursuant to Part 2 of this chapter. TCA 6811-203 F1 states that the Commission has the duty and responsibility to promulgate rules and policies deemed necessary by the Commission for the fulfillment of its duties and responsibilities under this part. These rules put into place the minimum licensing standards for PET and MRI services that came out of the CON program and into the licensure program. These rules are drafted to be uniform with the other rule sets that apply to all facilities that the Commission licenses and regulates. Our intention is consistency for the facilities we regulate to have clarity across the board. Furthermore, TCA 6811-209 C1 states that HFC shall prescribe by rules and regulations adopted by the Commission the minimum standards as to equipment and provisions for the care of patients or long-term care facility residents to which an institution must conform in order to operate lawfully, as any facility is required to be licensed under this part. In the development of these rules, the Health Facilities Commission formed a technical advisory group that supports the adoption of these rules. This group included members from Vanderbilt University Medical Center, Ballad Health, Baptist Memorial, University of Tennessee Medical Center, Knoxville, Premier Medical Group, Radiology Partners, American College of Radiology, Tennessee Hospital Association, HCA Healthcare, Tennessee Oncology, and Ascension Health. There were 3 public hearing comments. 2 comments were related to the broadening of accreditation requirement to any accrediting body that is nationally recognized and CMS approved. HFC made this change in the rules. 1 comment was from the HFC's Division of Administration recommending a decrease in the licensure fee. HFC made this change in the rules. I'm happy to answer any questions you may have.
Well, thank you for that explanation. Members, do we have any comment or questions for our guest? Representative Renaud, you're recognized.
Thank you, Mr. Chairman. My comment isn't as much pertaining to the bigger section of these rules. I do want to put on the record some of the concerns I have with that we've already discussed that I think are important to just put out there. I know that you said you have to, in our conversations previous to the hearing, that you want to have uniformity in all the places that you have these rules in regards to patient safety and whatnot. My concern is that when I reviewed the CMS information that you sent me, my understanding from what you sent is that the CMS rules only really requiring reporting of the FluVax uptake. It doesn't require a program to push for the flu compliance vaccination. It doesn't require education. And then the bigger concern is because the reporting requirement that the rules state that they have to report who chooses not to do it and the reasons why is actually very coercive and likely violates some sort of coercive anti-coercive act that I feel like I've read at some point. That is a concern. And then I think another concern as well is the mention of the healthcare provider being able to decline to comply with individual instruction kind of conflates these 2 issues. And because that they're written in these rules, that a provider's right to decline something based on their right of conscience is very different from providing general care to a patient. And I think that there could be some confusion down the road in how these rules are implemented. So I just want to put that concern. For those reasons, I will not be able to vote in favor of these rules.
Would you like to make any comments?
You're good.
I'm already on. Okay, everybody hear me? All right. So Scott Farragher, rules attorney for HFC. So let me just address some of those concerns. So for starters, the main reason behind this is in terms of infection control. So the declination statements aren't meant to be coercive. The reason they would be maintained is the same reason CMS requires it for certain facilities, is simply because in terms of infection control and the possibility of an outbreak. It allows the staff to be able to know who has been vaccinated versus who isn't, so who may be able to stay on versus who can't. Similar to like if you have an infection outbreak and then you have to shut down a school, it's to try to prevent the interruption of services for patient safety. So that's the reason it's generally included. It's also included in another rule set over 0720-30, which has to do with medical equipment from home care health providers. And so in theory, the whole thing is that we're essentially, this set of rules is trying to make sure wherever the MRI PET machines are set up that are not inside like an ODC or a hospital is safe. I mean, that's the whole purpose behind it. It is not a mandate. They have the option of declining to get a vaccine. The vaccination, and again, any sort of inventorying would only be so that in case of an emergency or in case of a breakout, that they would know, what was the most likely staffing scenario to try to keep patient safety and prevent interruption of service.
Representative Renaud.
Thank you, Mr. Chairman. Well, I think it's also, for someone who, whether they get the vaccine or not, you can just as easily get the flu even if you have the vaccine. The flu declination statement, I actually pulled a copy of what they have to sign that says that they realize they may be at risk of influenza infection, and then also they put other patients in that either they come in contact with it, but the same is true even if you get it. The concerning thing is not so much that you're collecting the information. It's fine if you want to get the information on who doesn't decline it. The declination form requires them to explain why they choose not to get it, and that's the more concerning part, because that seems very coercive. Somebody does not want to disclose why, whether they have a previous medical condition or they have a religious exemption. That is the more concerning part, is that it feels very coercive that someone has to disclose why they choose not to get it.
Would you like to follow up?
Sure. Essentially, again, I just reiterate that it is an optional requirement. Whether or not they choose to get the vaccine is an individual choice. And it's certainly not meant to be coercive or otherwise.
Okay, thank you for that. Next up, Senator Bowling, you're recognized.
Thank you, Mr. Chairman. I too have an opposition to this. It definitely sounds coercive, and it seems unnecessary, and it seems like it came right out of the 1980s when HIV, when everybody was trying to be afraid of HIV, don't put your hands on handrails. It was just over the top, and that was another Fauci episode in our lives, and one episode was enough, and we were blessed to have another episode in the last few years. So I think that this whole section, it seems fear-mongering in some ways, and it's certainly a violation of privacy, and it's compared to many things. Every time we came to this room, when we're walking in the hall, everywhere we are, we're exposed to all sorts of things from all sorts of people. Probably the cleanest place we are is if you're going in to get an MRI or whatever. So I just think that this is definitely something that needs to be removed from code. I will vote against it, but it seems to be medically not indicated anymore, and probably not whenever it started. And if you could look it up and find out it was probably started in the 80s, then we would see that this is just beyond its timing. But thank you all for coming into my office, and thank you for talking. So I just would say this needs to be removed.
Thank you, Senator. Representative Fritz, you're recognized.
Thank you, Mr. Chairman. Thank you all for your time today. Fourth Amendment to the United States Constitution guarantees us a right to privacy. Whether it's intended to be a coercion or not, it will be used that way. We just lived through an episode of time in these United States where we had people. I'm sorry, did I lose your attention, sir?
No, I was just straightening.
Yeah. So we just lived through a time in these United States where we had individuals in government who selected based on lists and even recommended the termination of people because they weren't on the appropriate list. That happened at a high level. If we perpetuate that in the state of Tennessee, we are denying liberty to every single Tennessean, whether intentional or not. I would beseech you to rethink what we have in these rules, requiring some documentation of whether or not I have accepted a vaccination. That declination statement will be something, I assure you, that will be used against Tennesseans again, as they have been used in the past. So as you can probably tell, I'm a no on your rules. I love you. I'm not trying to be hard on you. I'm just telling you, it doesn't seem that our Department of Health is learning from things in the past. It is absolutely necessary that we preserve the right of people to make their own health decisions without any undue influence from the government. Thank you, Mr. Chairman.
Thank you for those comments. Senator Crowe, you're recognized.
Thank you. I have the same concern. I have learned that, what gets into a chart follows you. And some of the things that end up being on the record when you're younger can follow you when you're older, you're trying to get into a nursing home or whatever. And those things pop up and can follow you throughout your whole life. So I agree with those same those concerns, and would be better if we didn't follow those sorts of those actions. Thank you.
Thank you for those comments. Senator Jackson.
Thank you, Mr. Chairman. And I'd like to just ask, is the Health Facilities Commission, is this the flu vaccine portion of the rule and the other types of services you all regulate? And also, is the standard in other hospitals or healthcare facilities?
You recognized.
Yes, it is. And essentially, it's also required by CMS and federal law for different facilities that we regulate.
Senator Jackson, any follow-up?
No, thank you.
Senator Kyle, you're recognized.
Thank you, Chairman. I didn't read it that way, and maybe I didn't read it as deep and nefarious. I go to the doctor. Unfortunately, I hadn't had one for a few years, and I went in. They said, "Why haven't you done this or that?" I was going, "Oh, because I haven't taken care of myself." Or another person may say, "Oh, I didn't have the money." Another person may say, "Oh, am I supposed to be getting one of those?" A lot of seniors here, we think we're supposed to get shingles, the flu. I don't mind that at all. But you say it is, and it's optional, whether you answer why you did or didn't get so-and-so. I think it was just another check on the nurse or doctor to say, well, is there any reason? I could easily just say it's private. I just think that it sure helps me when they say, did you know, Ms. Kyle, you needed this shot, that shot? I think that's very helpful. This is just not these deep conspiracies that sometimes we get into. Exactly explain, it's optional and you don't have to answer, right? That's it. And that's what would follow my record. So I just want to be sure. Anything you want to say?
Yes, thank you. I just also wanted to add, just for clarity, because I want to make sure there's no confusion. This is not a program for patients. This is just for the medical staff. This is not a requirement for patients. Okay. This is just for the staff, okay. so that there's to try to avoid the interruption of services in case of an outbreak. That's really and just for infection control as a whole. That's the bottom line, honestly.
Thank you for that. Leader Camper, you're recognized.
Thank you, Mr. Chairman. Mr. Chairman, two questions while we out of session. Did we have someone scheduled to testify? Someone else scheduled to testify?
I'm sorry, Leader, we've not gone out of session yet to hear from our visitors.
Okay.
No.
All right. Thank you, Mr. Chairman. Secondly, man, I really wish that last comment I heard and the Constitution giving us all these rights and protection, I wish that whole thought would apply to women when they talking about what's happening with their body. Give me that same fight. Thank you, Mr. Chairman.
Representative Reedy, you're recognized.
Mr. Chairman, let's go out of session this time to hear from our visitor.
All right, we can do that. Without any objections, we'll go out of session. On our list today, I have Ms. Bernadette Payer, and Brittany Ruiz. Ms. Ruiz, you look like you are situated and ready. If you would introduce yourself, tell us who you're with, if you're associated with any group, and we'll give you 3 minutes for your comments.
Thank you so much. Can you hear me okay?
We can.
Awesome. My name is Brittany Ruiz. I'm a citizen advocate. I've been doing this for over a decade. I'm here specifically with no organization, just somebody that's very interested in policy, as I have been for a very long time. I am in support of the Medical Ethics Defense Act. I am not here to oppose it. I'm here because the rules implementing it can be weaponized against the very patients this legislature never intended to harm. Last year, in Tennessee, a pregnant woman was denied care by her doctor, not because of a procedure he objected to, because she was not married. This happened because these rules draw no line between objecting to a procedure and refusing a patient. Section 63-1-903A1 protects conscious objections to a specific procedure, does not authorize turning patients away for who they are. The proposed rules enforce neither that limit nor the Act's own duty clause under that chapter. When I raised these concerns as a constituent to Senator Jack Johnson and Representative Lee Reeves last year, they confirmed to me that this was solely about protecting providers from being compelled to perform abortions and transgender surgeries, not turning patients away for who they are. House sponsor Rep. Brian Terry told his colleagues on the record that this bill prevents moral injury, so doctors can practice with a clear conscience, and that it was not about refusing care based on patient characteristics. That it was about, that is what was represented to every legislator who voted for it. These rules now contradict it. My own brother and sister are Jehovah's Witnesses. Their faith prohibits blood transfusions. Under these rules, a provider could refuse either of them a life-saving procedure, claiming conscience. Two people in that room have deeply held religious beliefs, but only one person's protected, not the patient. Rule 0720-47-06 requires facilities to implement annual influenza vaccination programs and collect signed declination statements from any staff member who refuses the flu shot. That language does not appear anywhere in the Medical Ethics Defense Act, not once. And the statute cited as this rule's own authority govern the physical plant and licensing standards for units of major medical equipment, buildings, and equipment, not vaccination policy. Under Tennessee's Uniform Administrative Procedures Act, an agency cannot promulgate rules beyond its statutory authority. This rule does exactly that. And that is a legal problem entirely independent of any vaccine debate. Under Tennessee Code 4-5-226, the burden is on the agency to justify these rules, and they have not done that.
In about 10 seconds.
Awesome. I asked this committee to issue a stay, and I'm available for any questions if you have them. Thank you so much.
Thank you for your comments. I hope I didn't mangle your last name. Ms. Bernadette, if you would, please introduce yourself for the record and tell us who you're with, if anybody.
Yeah, thank you so much. It's
You've got
Bernadette.
3 minutes also.
Okay, Bernadette Pager with a hard J. And I'm a volunteer, Tennessee Director of Stand for Health Freedom. I want to start, my opposition is to the flu vaccine rule also. But I want to start by saying that this rule is really outdated wherever it is, because the current science on flu vaccines does not support that it protects public spaces or hospitals. The proposed rule and all existing similar rules assume that flu vaccines protect patients in medical facilities, but peer-reviewed research says otherwise. Intramuscular flu shots do not produce the nasal antibodies needed to prevent respiratory infection or viral shedding. A vaccinated individual can still catch and spread the flu and other respiratory infections. In fact, a 2012 randomized trial from vaccinated children had more than 4 times the rate of other respiratory infections. That makes you more susceptible for a window of time. And a 2020 U.S. Department of Defense study of nearly 10,000 military personnel found that flu-vaccinated individuals had significantly higher odds of endemic coronavirus. So this is a problem. We need scientific integrity in public health policy. I also want to point out that these owners, these licensees of this heavy metal equipment, they don't know anything about vaccines. They're being tasked with educating their staff and employees about a flu vaccine, let me see, it says about flu vaccination, non-vaccine control, and the diagnosis, transmission, and potential impact of influenza. This is outside of their scope of practice. They're being asked to do something that's not in their realm. You go to your doctor to get this information. This also, Rep. Renault talked about coercion. She's might be remembering Section 63.1175 passed in 2024. It makes it illegal for a medical practitioner to coerce a vaccination, but owners, licensees of this heavy metal equipment don't fall under that because they don't give vaccines, and so this anti-coercion law does not apply to them. And yet they're required to get a declination signature. There's no opt-out if somebody doesn't want to sign it. There's nothing written in there that says what you do. So coercion can be implied. So, as it's written, it tends toward coercion. And the third I want to bring up is the Restore Trust in Public Health Messaging Act that was passed in 2025. And so this rule is the commission utilizing licensees of these heavy metal equipment in other places to promote flu vaccination. It's all about promotion, but any good faith attempt to educate employees about flu.
Sorry, I should have given you the 10-second warning. My bad. You're out of time there. Senator Bowling, you're recognized.
Thank you. I would ask you to repeat what you were saying when you were cut off, because I think you were getting to a very critical point about legislation restoring trust in Public Health Act.
Recognized.
Yes, thank you so much. So the Restore Trust in Public Health Act requires that the Department of Health, the executive branch, and any communications going out and anything that they give directly or indirectly must adhere, cannot conflict with, or be not unsupported by product labeling. This is so that we can make sure, after COVID, there was a lot of mistrust in public health messaging. So this is to ensure the public, when the messaging goes out, it's absolutely accurate, and that FDA label is the most accurate. They're required to be updated regularly with safety and effectiveness information. But these entities now being tasked with providing flu education, this is not their realm. This is not what they do. They really don't have that capability to give proper education. So they really should not be doing that.
Thank you.
Representative Renault? All set. Representative Towns?
Thank you very much, Mr. Chairman. Two questions. I want to talk about viral shedding, and I want to make sure that you clarify for me that you're saying that if a person has refused to receive the flu shot, that they can be refused medical service? Is that what you said?
Are you referring to my testimony?
I am.
So, sorry.
Then I'm coming back to you.
Representative, thank you for that question. I think the issue, my issue is actually two separate things. The flu policy is for the employees themselves.
Okay.
That is an issue in itself where it's not contained in the actual bill and in the statute. So it shouldn't even be in this rules. That's what my issue is with that. Separately, the other issue is the discrimination against individuals and their religious beliefs, because the way this is being worded and it's being used and misused and mislabeled is now saying that, well, we disagree religiously or medically, so now I don't like your position on, for example, let's say a medication or a vaccination. Well, I don't want to see you as a patient. Per the current rules, there's no protection against patients seeing that provider. So my issue is that we need to augment the rules, strengthen the rules to make sure that we're not discriminating against individuals for their patients' choices. Right now, this bill was supposed to be for providers' protections, but now it's being used to discriminate against patients. That's the concern I have. So the language we have to fix the rules. The rules need a broader stakeholder body with multiple parties involved so that we make sure that patients are protected, and same with the providers. That was my two major issues. Thank you for your question.
So what would you suggest? Or are you at that point?
100% at that point. Yes, we need, there is language that we can provide to rules to make sure that we capture what's existing law, which is informed consent, make sure people have a choice, and that make sure that medical decisions are not being discriminated against by a provider. Because you're looking at two different things. You're looking at a provider in procedures, and you're looking at a patient and their beliefs. We have to make sure that those are clearly delineated in the rules, that we're still protecting the patient's rights here. We're not going to discriminate against those. So it doesn't require a lot of rules, and I'm happy to be a part of that body, and I'm happy to rope in some other people that are very educated on this issue to make sure that the rules make it clear that we're not going to discriminate because somebody's unmarried.
Absolutely.
Thank you.
Next, my question to you. You got it.
Yes, thank you. So flu vaccines, the injected type, are not live, so they do not shed. There's no viral shedding.
So what do you mean when you say shedding?
Shedding happens with the MMR, which is a triple live vaccine, with the chickenpox vaccine, but it does not happen with inactivated vaccines. There is a nasal flu version, not much uptake. It usually has 0% efficacy. That does shed, and that can be a concern for several weeks following administration. What happens with the flu vaccine is it temporarily impairs your immune system reaction, so it makes you more susceptible to non-target infections. So you might get antibodies to the flu in the vial, but any other strain of flu or any other respiratory infection, especially certain strains of, say, coronavirus, you are now more susceptible to for a window of time.
So shedding itself, I thought was this, please correct me, that if I had it and I'm in the public, that I am contagious because it's shedding off of my being to possibly somebody else. Is that correct or not?
It's only if you get a live vaccine.
Okay.
Now, there is still a lot of science being done about the COVID vaccine.
Right.
Our discussion here is about the flu, which is the injected, is the inactivated. It does not shed. But if you have the flu, if you've been vaccinated and you're exposed to a form of the flu, not in the vial, or another respiratory infection, you're shedding, but you're shedding your own infection, not anything from that vaccine.
Well, thank you, Mr. Chairman. The distinction is the COVID and the flu vaccine. That's what I needed to hear.
Okay.
Two different deals. So, Mr. Chairman, thank both of you all.
Yes, sir. Let's give the department a minute. It sounds like the crossover here, and please correct me if I'm wrong. It sounds like the crossover here is, are we dealing with a policy that's intended for the employees of these units, or are we talking about the public? You've heard the same conversation I've had. Please, if you would like to.
Yes,
comment.
it applies to the employees. Again, it is literally just for infection control purposes. That's it.
Senator Rose, got you next up. It's not.
Yeah, there we go. Thank
All
you.
right, should be hot.
Mine is to the Department of the Commission. Is it okay to ask them?
Or if we're ready to go back in session, members, let me clear that. Good,
That's fine.
thank you. Any more questions for our guest? One question for our guest? No, I'm sorry, not for the department. Okay. You guys can go ahead and head back to your seats, make yourself comfortable. We'll go back in session. Yes, sir. Representative Parkinson.
Chairman, with us being out of session, the administration could be part of that out of session conference so we can have both at the table, because I had questions for both when we got to it.
Okay. Did you still want to ask your question of our guest?
I did want to ask a question. I can ask them the question.
All right, since I got you on the mic, go ahead, you're recognized.
Thank you, Mr. Chair. In that language, where was it, right here? Right, under number 4, an annual evaluation of the influenza vaccination program and reasons for non-participation. Is that for the medical personnel?
It is.
Right, and so why do they owe an explanation for that?
So, I mean, that's just, okay. So I guess the explanation could be as simple as that they're whatever reason they give for not getting the vaccine is an acceptable reason. It doesn't even have to be a reason in theory. This is language that's just standard across the sets. This was also language that's used by CMS. And so we took this language, and additionally, the accreditation bodies also require infection control mechanisms, and the accreditation is also required by state law. So all of these pieces and components are just basically for consistency across the board. And again, in terms of being able to, monitor if there's an outbreak, to be able to determine which personnel you have that might be less likely to be infectious or be affected by infectious population. It's just a protection mechanism for the medical staff and the patients that come in.
Follow up?
Yes, sir. Thank you, Mr. Chairman. And I get that. But a simple asking if they've been vaccinated and they say no, should suffice. And but to require a grown person to give you an explanation as to why they either chose to or chose not to inject something into their body is a bit problematic. And I'm surprised that not surprised that that's happening at the federal level under the Trump administration, according based on what you're saying.
Mhm.
Right. And but it speaks to the level of government overreach into our private spaces, right? And it would be really much simpler for y'all just to strike the explanation part from these rules, because that's obviously there seems to be bipartisan discontent in regards to having to give you an explanation. If I said, hey, why didn't you come to my party last night? And you said, and you as another adult to me, you don't owe me an explanation. You can say nothing, just sit there in silence, right? Or if you want to, but for as an adult, I wish the person would, and I had another word for person, would force me to give them an explanation for a decision that I am making in regards to the last bastion of freedom, which is my body. And so that one wasn't the best, strategy. I don't know, where it comes from. Y'all call the names out. Who told y'all to do that? I'm just kidding. You don't have to call the names out. But you might want to revisit that. Thank you, Mr. Chairman.
Yes, thank you. We're going to go out of, would you like to respond to that?
Yeah, so just as I'm looking over this, are you referring specifically to the declination statement itself when you say explanation?
You're recognized.
Thank you, Mr. Chair. I'm under, what's that? What page is it? Page 91, right? Mm-hmm. Page 91, number 4 at the top. Y'all got that? Mm-hmm. I mean, I don't care who it's for. I don't care if it's for the doctor or for a patient or for the for housekeeping. Nobody owes any government entity an explanation. Either they got it or they didn't. If they didn't get it, that's it. That should be it. I mean, it's okay to ask, hey, you got a flu shot? But then say why? Man, what? So yeah, y'all might want to rethink that one.
You're recognized.
So I'm sorry, just as a moment of clarity, I was looking at that and wasn't connecting what you were saying for a second. So just to be clear, number 4 actually requires to the program itself and what the reasons for non-participation, not from the individual, but from the programmatic side. Do you understand what I'm saying?
Okay. Well, since he ain't looking, let's talk. Yeah. So, no, I really don't understand what you're saying. So, for those of us that are visual, explain that so if somebody, if the program itself was not participating, it says here an annual evaluation of the influenza vaccination program and reasons for non-participation. So if they were, is that if somebody was not administering the program in under these rules, or what- to explain it? Tell me how that works.
So the way I read that, it would be that if you are not having participation in the program itself, right, for people that are not being vaccinated, what's the general, what is the general reason? And that's probably just for tracking purposes of what some of those concerns are. But it's not an individual, it's not an individual basis, you know, again, that's where the declination statement comes in.
And, okay, and just, since he's still not looking, come on.
You're fine.
So just for the, so is this program permissive in nature, or is this something that's mandatory?
No, sorry. Yes,
yeah,
it
we're
is.
good.
I mean, it is mandatory to offer to have the vaccination offered and to get a declination statement from staff. That having that program is a mandatory component, but participation of individuals in terms of getting vaccines is by no means a mandate. And again, from a programmatic side, just so that when you're understanding why something is or isn't working, or why there's awareness or not awareness, it's not, again, it's just for the purposes of infection control.
And when you mentioned declination from the staff, what all is included in the declination from the staff?
It's a signed form that makes a statement as to why or why not, but the statement could be nothing. I mean, it's just a signed statement.
Right, but that's the problem, right? Even though this is another section talking about the program, still there's a declination by the staff and a sign, I didn't even know it was signed, so that, I'm really against it now. So a signed declination from the staff giving their reason as to why they did not, have a flu shot. I mean, who is the authority that dictates to a grown adult as to why they have to give a reason for refusing a flu shot? I mean, come on. I
understand.
Yeah.
I understand what you're saying. I mean, again, it's, the standpoint, my standpoint is and will remain, it's a matter of infection control and just trying to make sure that if there's an issue, there's no interruption in service, standard across the facility types. It's, it's also in CMS language for certain facilities. This is, but I understand. I mean, I get it.
And then the last thing with the declination portion for the program, right? If the program is mandatory, why is this language in here? Because they're going to be doing it. Am I correct?
Right. I believe it's just I believe the reasons for non-participation just simply means why maybe there's not as much participation in a vaccination program for the staff. That's how I would read it.
Even though it is mandated.
Having it is having the program available is mandate. Participation in said program in terms of being vaccinated is not mandatory. No.
Okay. All right. Okay, man. Thank you, man. Sure. Appreciate you.
Yeah.
Okay.
Absolutely.
Senator Rose, you're recognized.
Mr. Chairman, I only have one question. Did you have a rulemaking hearing on these? Did you have a rulemaking hearing on these rules?
Yes, I did.
Okay, I did not see it reported. I may have missed it. Can you tell me what page it's on in our report? $69. Thank you, Gabe.
69.
Yeah, that's what I heard. Yeah.
Yes, sir.
Just to follow up, I missed it, and thank you, Representative, for letting me know. Did any of these concerns come up during that rulemaking?
They did not.
Okay, thank you.
All right, next. Yes, sir. Next on our list, Representative Reedy.
Mr. Chairman, I'll yield to Representative Faison at this moment.
Representative Faison.
Thank you, Mr. Chair. Mr. Chair, I'm not sure if this is for the department or for legal, but I'll put the question out. Members, the vast majority of time that we vote on rules, the rules come on the tail end of legislation that we passed the previous year or that year. This would have had to been a year ago. We hadn't passed this bill. So my question is either for legal or y'all, is this a rule that's come in on legislation that we as a body have passed, or is this something independently that the department has decided to do?
If I may, it is Public Chapter 985 of 2024. dealing with these services coming out of certificate of need process and into licensure. So these are just minimum licensing standards, borrowing from the licensing framework that we in our rule packet that we inherited from the Department of Health in 2022.
Follow up?
Here. So thank you for that. So in the legislation that we passed in 2024, did the legislation say that we're marrying up with the federal guidelines from CMS? Was there language in there that said that y'all need to do this for employees of healthcare facilities?
No, sir.
Oh, okay. So that was right there. You just said no, sir. So these are rules that y'all are adopting that we didn't necessarily put in the language of the law. Is that what I'm understanding?
Yes, sir. So if we put licensing standards in the framework that was already existing, is what we did.
Is there money attached with this that would potentially come from Medicaid, Medicare, CMS, something like that? Is there some sort of money from the regulation that we would lose if we didn't do this?
I'm not sure on that one. I mean, I could hazard a guess at it, but I don't want to speak, without being certain. I mean, it's something I can look into and get back to you. I mean, in terms of regulated facilities that are that CMS reimburses the provider and, that acts under the, that aspect of it, yeah, that would be a requirement. That's why it's in there originally. Now, in terms of major medical equipment, because it's kind of its own thing now, because like all those standards still apply to the regulated facilities, but like in this situation, because these are unique pieces. And when we were drafting this, like, again, like the main thing behind it, right, is like, we know that these pieces of equipment are not, we're not talking about the ones that are in ODCs or in hospitals. These are individual units that would be in physicians' offices, mobile units, et cetera. So we were just trying to create a framework, because a part of the understanding of moving from the provider standpoint, as far as we understand from the tags, was that moving this stuff from CON into a licensure framework was partially about quality control and quality standards, and trying to make sure that there was an improved, enhanced version of what's safe and what's effective for patient safety. And so essentially, in doing so, trying to just create a framework to ensure that these were just standard pieces of infection control that are just found throughout, that we moved over, because they were also already and have pre-existed inside the home health care provision of medical equipment. And that medical equipment is not as substantial as this medical equipment. So in theory, if you have that infection control device there, you would also want similar protections here. So that's where it comes from. It really was just language that was moved over because it made sense in that context of that infection control piece.
One more question. You just said language that was moved over. Can you expound? Moved over from where?
From other rule sets. We just copied that same language. I mean,
So
I had
this
to make
is common in Tennessee.
Yes.
We've adopted these rules such as this for other practitioners doing certain things.
For other facilities. Yeah.
That's what.
Thank you. Next up, I've got Chairman Reedy. Did you want to be recognized?
Yes, Mr. Chairman, if we could go out of session, a question for legal. And in that question would be covering if they decide to pull the rules, or if we stay the rules, or give a negative recommendation.
Let's go out of session for commentary. Dr. Garrett, you're recognized.
Thank you, Mr. Chairman. Doug Garrett with the Office of Legal Services. Chairman Reedy, the options here would be, because the rule has not gone into effect, you could request the agency to withdraw it. You could issue a negative recommendation or a disapproval. That means that the agency still could implement the rule up until the passage of the Rule Omnibus Bill in March or April of 2027. they could interpret your response, also interpret your response by a disapproval of the rule, by withdrawing the rule. And lastly, there is an option in statute for this committee, pursuant to a motion, to stay the implementation date of the rule. And that there can be a rolling, what we call a rolling stay. I believe it's for 90 days at a time. Our office would file that stay. And that stay could be in effect until the 5th legislative day of the 2027 General Assembly. So those are your options, and I'll be glad to elaborate more if I need to on that.
Chairman Reedy?
No, thank you, Mr. Garrett. So in that time frame of staying a rule for 90 days, would that allow this department to rework those rules into the conversation we're having now, or it just brings it back as it is?
You recognized.
Thank you, Mr. Chairman. Doug Garrett again with Legal Services. That's a good question, Chairman Reedy. Within that 90-day period, and there could be more 90-day stays, the department can't what we call amend this rule, other than they can't amend it. They have to promulgate a new rule with if it's a permanent rulemaking hearing, with another rulemaking hearing itself. So they would have to withdraw and then bring a new rule that reflects whatever action this committee whatever action is the preference of this committee.
Chairman Reedy?
Thank you, Doug, for all that you do for the state of Tennessee, keeping us straight. But thank you, Mr. Chairman. That's all the questions I have.
Representative Parkinson, do you want to question legal?
I did. And to legal, Doug, thank you also. What you just explained in the stay, is that our version of just rolling this to the next meeting and that asking them to bring back a new set of rules absent this language in it?
I'm sorry.
Okay. So how do we just roll this to the next meeting and ask them to bring back a new set of, or ask them to bring back language that matches what our intent is?
Thank you, Mr. Chairman. Doug Garrett. What you would be doing is effectively tolling the implementation date, the effective date. They're kind of parallel, would operate, what you're saying, would operate on sort of parallel tracks. The staying of the rule just prevents the implementation of it. Whether the agency wants to withdraw the rule and bring another rule that reflects the intent of a majority of the members of the committee is up to them. But the committee has the authority to toll or stay the running of those 90 days that occur between the filing of the rule with the Secretary of State and the effective date of the Secretary of the rule itself. So the withdrawal is really up to the department, to the agency. Short of that, this committee could adopt a recommendation to disapprove this rule.
And just quick follow-up, adopt a recommendation to disapprove that particular rule or the entire draft of the rule?
Doug Garrett again. Thank you, Mr. Chairman. The guidance we've received, and it's the practice of this committee, has been to you can disapprove a portion of a rule, but it can only go down to what we call the point number. So you wouldn't be able to just disapprove item 4 or item 3. It would have to be that entire portion of the rule.
Sure.
The issue you get into with that is, okay, well, is the rule now functional? Can it survive with the remaining provisions of the rule, or does that effectively gut the rule?
Okay. Thank you, Mr. Chair. Thank you.
Yes, sir. Senator Crowe, do you have a question for legal?
I was just going to say to legal, why don't we just ask the department to pull the rule and then come back with a rule that matches the legislation we passed without the extra verbiage that's in there. But yeah.
You can't. Yeah, you can only
Settle down, folks. Doug Garrett, you're would you like to reply?
Sure. Thank you, Chairman Crow. The statute authorizes the committee to request them to withdraw the rule. It's only a request.
All right.
I would make that request, and then if you would, you come back with a rule that matches the legislation that we passed without the extra verbiage relative to, asking people about vaccinations and those sorts of things.
All right, we're still out of session. Do we have any other questions for legal right now? All right, not seeing any more questions for legal right now. We're going to go back into session. And you guys are getting a feeling for the cool air in here, I'm sure. What do you think about taking this opportunity to maybe withdraw, regroup, come back and see what we can come up with that works?
Happy to do whatever y'all tell us to do.
Okay, well, in that case, I would request that you, I'm sorry. Okay, I need a motion to request the withdrawal of the rule. Can I get a motion? We've got a motion and a second. So we've got a motion and a second to withdraw the rule. Clerk, on the withdrawal of the rule, would you please take the vote in the Senate? I'm sorry, real quick. Senator Bowling?
Section 7 is the culprit in here, the main part of this, all of it, page 90. Yeah. Right. And that entirety looks like it was lifted straight out of the 1980s. And it's paranoia about HIV and paranoia about other things. And that entirety needs to be removed.
Thanks for that comment.
There was
1 second, please. 1 second.
I mean, as
Okay. All right. This is the kind of fun we get to have in GovOps on days like this. we've got what we've got in front of us. We've got a few options. We've heard a couple of options. It seems like the easiest thing to do, and some of it's going to take us trusting the good faith of our friends from the Health Facilities Commission here. It looks like the best route is to give a negative recommendation with the assurance or the request that you guys will take into account our concerns and come back with something that's more palatable to this committee, so that you would withdraw the rule. So with that, do we have a motion for negative recommendation? Chairman Reedy.
Thank you, Mr. Chairman. I make a negative recommendation on these rules, urging the department to withdraw the rules and reconsider them later.
So we have a motion and a second. Proper motion, proper second. A vote in the affirmative. Ladies and gentlemen, a vote in the affirmative saying yes to this vote means that you are voting yes to not approve the rules. All right, everybody got that? Oh, all of it, all the rules. Okay. Everybody's clear on the vote. Madam Clerk, if you would, please take the vote in the Senate.
Senator Bowling. Senator Bowling votes aye. Senator Crow. Senator Crow votes aye. Senator Hatcher.
Aye.
Senator Hatcher votes aye. Senator Kyle. Senator Kyle votes no. Senator Oliver. Senator Oliver votes aye. Senator Rose. Senator Rose votes aye. Senator Seal. Senator Seal votes aye. Senator Sutherland. Senator Sutherland votes aye. Chairman Jackson. Chairman Jackson votes aye. Mr. Chairman, you have 8 ayes and 1 no.
Thank you for that. Members to the House, all those in favor of disapproving the rule, please indicate by saying aye. Any opposed? All right. Register with clerk if you like. The ayes have it. Rule moves out with a negative recommendation with the understanding that you guys are withdrawing the rule. All right. Thank you for being here. That takes us to item number 6. Also with the Health Facilities Commission. At least your seats are good and warm, right? When you're ready. Yeah. Please, once again, introduce yourself for the record and tell us about your role.
Thank you, Mr. Chairman and committee. My name is Katie Thomas. I'm with the Health Facilities Commission. With me is Scott Farragher and Rob C. Schultz, who is our trauma director. These rules were promulgated in conjunction with the Trauma Care Advisory Council to make updates to the rules for trauma centers to enable providers to make timely decisions, promote appropriate utilization of the trauma care delivery system, and ultimately save lives. Trauma centers are designated by the Health Facilities Commission. Hospitals voluntarily seek trauma center designation in order to care for the most seriously injured patients with the goal of reducing patient mortality and morbidity. HFC is responsible for conducting the inspection process by contracting with qualified trauma surgeons and nurses and scheduling trauma center inspections that are conducted within a 3-year designation period as stipulated in the commission rules. These new rule changes reflect Tennessee's commitment in bringing trauma center standards in line with national standards. HFC received 1 public comment requesting clarity, and the commission approved the suggested clarifying language. We're happy to answer any questions you may have.
Thank you for that explanation. Representative Fritz, you're recognized.
Thank you, Mr. Chairman. Thank you again for your time. How many level 1 trauma centers do we have in Tennessee? And do we feel like we're proportionately servicing the population of Tennessee with such?
Good afternoon, Rob. Good afternoon, Rob C. Schultz, Trauma System Director for the Health Facilities Commission. We have 6 level 1 trauma centers here in the state, 1 regional 1 in Memphis, Vanderbilt University Medical Center here in Nashville, Knoxville, UT. We have Erlanger in Chattanooga and Johnson City, which is in Upper East Tennessee. Certainly, as we talk about trauma deserts, we're missing some trauma centers that could really cut the transport time down for our critically injured patients, probably somewhere in the region of Memphis and Nashville. We are missing any state-designated trauma centers in that area.
Follow up.
Thank you, Mr. Chairman. Just one follow-up. What is our longest transport time by air ambulance now for those trauma deserts that you mentioned?
Typically, when a study was done, I believe probably 10 to 15 years ago, every citizen within the state of Tennessee within 100 air miles of an air medical provider. So they have greatly reduced transport times to larger metropolitan trauma centers here in the state of Tennessee.
Thank you.
You're welcome. You're welcome. Members, do we have anyone else with a question? Senator Jackson.
Thank you, Mr. Chairman, and thank you for being here. And I live in Jackson General Hospital and West Tennessee Healthcare. Where do they rank? I know they're working on trying to be a Trauma One center, or that we've talked about that. I've talked about that with them, and I didn't know where they ranked so far as that goes.
Currently, they are not a state designated trauma center. They used to be approximately 15 to 20 years ago, or maybe a little bit longer. I'd have to research that, but they used to be, I believe, a level 3 center here in the state, but they no longer function as a state designated trauma center.
Thank you.
Yes, sir. Thank you. Members, any other questions? I've got one. It's a little bit off the wall, I guess, maybe. I am curious, a full-time injury prevention coordinator that is to help prevent injuries in an area. I'm dying to know. Tell me what that job entails. What does that look like?
Well, for requirements for trauma rule, the higher level centers, level 1s, and more specifically level 2s, are required to have a full-time FTE to garner injury prevention activities for that center. Our top 3 mechanisms of injury and fatalities here in the state are falls, motor vehicle accidents, and assaults. Those injury prevention coordinators for the higher level centers, their responsibility is to provide community outreach for what they're seeing in their trauma center. For example, if they have more penetrating trauma like assaults or firearm injuries, they're to be reaching out to the community to help prevent them, similar with falls and motor vehicle crashes as well.
So sounds like kind of a public service role.
Yes, sir.
Of sorts. Okay. All right. Curiosity got the best of me. Members, any other questions? Seeing none, can we get a positive recommendation? Oh, I'm sorry. Somebody covered up my reminder here. Do we have anybody for public comment? All right. Seeing none. Vice Chairman Reedy? We have a motion to second for positive recommendation. Madam Clerk, if you would please take the roll in the Senate.
Senator Bowling. Senator Bowling votes aye. Senator Crowe. Senator Crowe votes aye. Senator Hatcher. Senator Kyle. Senator Kyle votes aye. Senator Oliver. Senator Oliver votes aye. Senator Rose. Senator Rose votes aye. Senator Seal. Senator Seal votes aye. Senator Sutherland. Senator Sutherland votes aye. Chairman Jackson. Chairman Jackson votes aye. Chairman, you have 8 ayes.
All right. Thank you for that. And on to the House. Members, all in favor indicate by saying aye. Any opposed? Ayes have it. Rule moves out with positive recommendation.
Thank you, Chairman and committee.
Thank you, guys. Appreciate you being here. Next up, item number 7 with the Department of Safety. Come on down, and when you're ready, please introduce yourself, who you're with for the record.
Good afternoon, Chairman and committee members. Graham Tudor, Director of Legislation with the Tennessee Department of Safety. With me is Elizabeth Stroker, our General Counsel at the department. We did choose the cooler seats, hoping a little bit better luck over here. So good. Again, the department is before you today with newly promulgated Rule 1340-03-07 to set the procedures for declaratory order petitions received by the Department of Safety. TCA 45223 sets forth that affected persons may petition an agency for declaratory order as to the validity or applicability of a statute, rule, or order within the primary jurisdiction of an agency. This statute requires each agency to promulgate rules for these petitions and declaratory orders. While conducting our retrospective rule review, the department realized that rules were not in place, which necessitated the rules before you today. These rules are based off the model rules established by the Secretary of State. The rules ensure fairness for all parties involved, including the petitioner. A rulemaking hearing was conducted on November 20th, 2025, and no public comments were received. At this point, happy to answer any questions you have.
Thanks for that explanation. Members, do we have any questions for our guest? Representative Fritz, you're recognized.
Thank you, Mr. Chairman. And Mr. Tudor, thank you for your service to the state and the people that you helped in the accident. We shouldn't have you come before us today without recognizing your service there. I know we recognized it on the floor, but thank you, and my hat's off to you.
Thank you, sir.
Just one quick question along those lines, and it's on page 175 of the rules, and it's referring challenges to the applicability of a statute. And unfortunately, we passed what I think was bad legislation this year. That's a different topic. But regarding challenging statutes and state law, can you tell me if item number 6 there at the bottom of page 175, is that consistent with what we're doing in all the other departments in the state of Tennessee and with the Secretary of State's guidance, please?
Yes, sir. So again, TCA 45223 sets out that process for someone to petition a state law or a rule or order. So that follows the state law. Yes, sir.
Thank you.
Okay. Members, any other questions? Seeing no questions. We have a recommendation for positive recommendation. We got a recommendation. We got a second. Madam Clerk, if you would, please take the vote in the Senate.
Senator Bowling? Senator Bowling votes aye. Senator Crow? Senator Hatcher? Senator Hatcher votes aye. Senator Kyle? Senator Kyle votes aye. Senator Rose? Senator Rose votes aye. Senator Oliver? Senator Oliver votes aye. Senator Seal? Senator Seal votes aye. Senator Sutherland? Senator Sutherland votes aye. Chairman Jackson? Chairman Jackson votes aye. Chairman, you have 8 ayes.
Thank you for that. Do we have any public comment? Seeing none. On the House, all those in favor of positive recommendation indicate by saying aye. Any opposed? Ayes have it. Rule moves out with positive recommendation. All right, next up, Department of Safety, item number 8. You guys know how we work. Please introduce yourself for the record and let us know about the rule.
Good afternoon again. Graham Tudor, Director of Legislation with the Tennessee Department of Safety and Homeland Security. With me is Elizabeth Stroker, our General Counsel, and we have a new addition, Major Travis Plotzer with the Tennessee Highway Patrol. The department is before you today with rules in response to Public Chapter 457 of 2025. This public chapter, known as the Modernization of Towing, Immobilization, and Oversight Normalization Act, also known as the Motion Act, tasks the department with promulgating rules for the uniform procedures for appeals for abandoned or immobile vehicles towed by the Tennessee Highway Patrol. Rule 1340-03-01 establishes requirements of notifying the owner upon taking a motor vehicle into custody, appeal request steps for an owner or lien holder of an abandoned or immobile vehicle, and conduct of appeal hearings offered by the department. A rulemaking hearing was conducted on November 10th, 2025, and no public comments were received. Happy to answer any questions.
Thank you for that explanation. Do we have any questions? Representative Fritz, you're recognized.
Thank you, Mr. Chairman. Just one question. Thank you again. It's on page 187, and I appreciate the intent of item number 4. My question is simply this. It says the THP district captain, if he or she determines that the vehicle should not have been towed or that the charges were unreasonable, then he can release the owner without charge or a reasonable amount. And I'm just curious, help me with what reasonable amount means if we shouldn't have towed the vehicle.
Recognized.
Thank you. And Elizabeth Stroker, Department of Safety General Counsel, and Major Plotzer, correct me if I mess this up. That would be reasonable amounts for storage and tow fees. So when we talk about the department towing something, it's not actually the department towing. We have a list of tow companies that are on our tow rotation list. So it would be reasonable fees associated with that towing company that would be determined to be appropriate in that situation.
You're recognized.
Thank you, ma'am. Thank you, Mr. Chairman. Thank you, ma'am. Just one follow-up to that. It says if the THT district captain determines that the vehicle should not have been towed or that the charges were unreasonable. So is there going to be a case then where we would have a citizen's vehicle that has been towed and there's a tow charge and an impoundment fee that they're going to have to pay even when it shouldn't have been towed? That was my question in the wording there.
You recognize.
So ideally, no, but I believe the statute itself leaves that open as an option. And so we have this option in case, maybe they didn't show up for 90 days and they got notice that they should have came and picked their vehicle up. 87 days ago. So things of that nature where there could be reasonable charges assessed to it. But if someone determines that we made that decision incorrectly, or they think that the fees assessed shouldn't have been based on the tow not being allowable, there's an appeal mechanism for that as well if they don't agree with it.
Follow up?
Thank you, Mr. Chairman. Thank you so much. Just one follow-up to that, and I appreciate, I know there's some compassion written into this. I get that. I don't want to lead it down to a discompassionate person who could charge for a tow and however many days of storage that resulted from an action in error by the state of Tennessee. And I would hope there's some way to correct that language to make sure that that's not the case.
Want to respond?
Yes, sir. And absolutely. And so I've been dealing with the towing and record stuff for as long as I've been here. And that process is in place. There are plenty of times where we see a tow receipt that is astronomically inappropriate, or where a towing company has assessed fines that they shouldn't have. And that's why, since we're talking about only people on our tow rotation list, we have a lot more authority over them to make sure that they're penalized or even removed from our list if they take inappropriate actions like that. Yes, sir.
One more follow-up, please.
I apologize, Mr. Chairman. Just one follow. I guess the better question is, shouldn't the state eat the cost if we in error towed the vehicle?
You recognized.
So again, kind of the nuance there is that we're not actually the ones doing the towing. It's that towing company who is doing it on behalf of the state. And so that's where we can't just flat out disregard and negate everything that private company has done. So that's where that's why we have that little bit of flexibility there in case there is a situation where, yes, this may have been towed inappropriately, but they left it with the company for a year. We can't expect that the company eat that storage cost when they should have picked it up a year ago. And so that's why we have that little caveat in there to make sure that the company who towed isn't put out of business or, eating costs that they reasonably should have incurred.
Representative Fritz.
Thank you, Mr. Chairman. Thank you, ma'am. I appreciate that. But that towing company is acting as an agent of the state of Tennessee in doing that, correct?
Yes, absolutely. And that's why we have, I don't want to say more requirements, but we have a much more stringent requirement on the people who tow for our state so that we can take action on them if they do anything in this manner that you're describing.
Thank you.
Yes, sir.
Thank you. Senator Sutherland? You recognized?
Just one moment, please. Yes, I have a question. What if it's a deployed military person and it's over the time period and their vehicle's been towed illegally or unintentionally? You're going to charge that military person when it was the state that had that vehicle charged or towed?
You recognized?
No, sir. Again, that language is only in there if there is a very specific situation where reasonable cost would have been ascertained. Obviously, if someone was towed illegally and they're, overseas, we're not going to charge them for that. That is just catch-all language that we need in the statute for reasonable fees that may need to be assessed based on the towing company and their storage.
Thank you.
Representative Glenn, you're recognized.
Thank you, Mr. Chairman. And I know you say you all work with selected towing companies. Are those towing companies, so if I call a towing company to come and tow me off the highway, they charge me $300, right? But if you all call and have me towed, they can charge $1,200. Is that something you all look at as well?
You recognized.
No. And so kind of how it works is if you want to be on the THP towing rotation list, you have to go through a background check. You've got to get approved. You go through, I don't want to say audits, but very stringent requirements if you want to tow on behalf of the state, because obviously it is the state. We want to make sure that people aren't treated unfairly or charged inappropriately. And so we follow the requirements of fees and what can and can't be charged that was set up by the Motion Act, which is the reason why that bill passed last year, because there were discrepancies throughout the state, not with THP. THP had standardized towing rates that we've always used, but other companies in the state that are not a part of THP rotation. So that's why they standardized it in that Motion Act. And so, no, we can't just arbitrarily increase an amount for towing because we would want to. And another point of clarification, the THP towing list, that is if you, let's say we've got to tow your car, you were in a wreck, whatever the situation may be. If you want to call your own tow company, you have that right. So this only comes into play if one, it's an abandoned vehicle, or two, if you say, hey, I don't know who to call, can you call someone for me? So there's always that option as well of going outside. This is just if you don't know who to call. And again, we are the responding agency. So it's still, we still have to follow the statute that was passed that sets the fees and caps and stuff for that.
Follow up?
Thank you, Mr. Chairman. I would definitely recommend you look at these companies, because if Ronnie Glenn called and said, hey, Mr. Whatever, could you come tow my car? They're going to charge me $300. But if you pull me over and you have to tow my vehicle, they're going to charge me $1,200. I'm telling you, it happens. I'm just saying, I would definitely look at these companies and make sure they don't have a chart that says a regular tow is $3, but if the state trooper has me tow, it's $12.
You recognized?
Yeah, we'd be more than happy if you can give us a specific example of that. And I will say, when you're talking about a different level of chart, it does depend on the vehicle. So it is definitely a lot more expensive to tow an 18-wheeler or something of that nature. So there are classes based on the type of vehicle. So I do want to make that clear. But if you could send us the situation you're talking about, we can absolutely look into that.
Thank you, Mr. Chair.
Thank you. Representative Parkinson.
Thank you, Mr. Chair, and thank you all. But tell me, give me an example of an erroneous tow done by THP.
Major Plots for Tennessee Highway Patrol. Sometimes what we see when we talk about erroneous tows and stuff, we see where people overcharge. We as the state, we set maximum fees, and that might also address Representative Glenn, your concern. We set max fees that they can charge. And then if we get complaints or something, we go look at those complaints on a case-by-case basis. Or if we receive a complaint from a citizen from an egregious fee or something, we actually look at that to make sure that it abides by the rules that we have set forth. And we'll take actions against those, sir. Thank you for the question.
Your follow-up?
Yes, sir. And thank you for that. And that helps a lot, because I was, so really there are no erroneous tows directed by THP. There are erroneous fees assessed to an individual whose vehicle was towed and as directed by THP.
You recognized.
Major Plots or Tennessee Highway Patrol. And that's right. Sometimes what we see is there's overcharging and we get some astronomical bills, and we want to make sure that the citizen that's either a resident of the state or passing through that's had an unfortunate incident where we've had to tow their vehicle, because they might not know a tow truck there. We'll just go off the list. We want to make sure that they're charged properly and fairly.
Just follow up. Thank you, sir. And if there was, let's say, a vehicle that may have been part of an investigation and it's towed, and the investigation finds out that that individual's vehicle was not involved in any of the stuff that was being investigated, is that person still on the hook for that towing fee?
You recognized.
I can't answer that question. If we're talking about something that's through the course of an ongoing civil or criminal investigation, there is a different mechanism for how evidence is handled, and I don't want to say the word, but if it is seized civilly, there's a process that is handled for that when it comes to how evidence or property can be returned, adjudicating costs, things like that. So I can't give you a definitive answer on that because it depends on if it should follow the criminal or civil process. And there are specific rules and statutes that dictate that.
Okay, thank you.
Leader Camper.
Thank you, Mr. Chairman. Is it possible for us to get a copy of your fee schedule?
Absolutely.
Okay, thanks. Thanks, Mr. Chairman.
Any other questions?
It's also on our website too, but I'll send you, we'll make sure Graham gets the link to everybody.
All right. Any other, Senator Seal?
Thank you, Mr. Chairman. You mentioned a little bit earlier about, if you had excessive, the people that are on your list and they're charging excessively, what accountability measures do you have in place to check that?
You recognized.
Yeah, so I've handled some of these cases. I've handled some of the companies that we have removed from our list, suspended from our list, things of that. They're required to be maintained, audited, reviewed by the THP regularly to be on our list. The majority of how it happens that we find out and we take action and we will remove someone is your constituents. They'll reach out to us and say, hey, this company told me, I just got the bill, this is insane. And that's where we will create an investigation, we'll do a hearing, we'll do a full assessment of the cost, break it all down and determine if it was inappropriate. We can readjust the fees that should have been charged to make sure that the customer gets paid back that money. And so we have a very robust process for handling complaints or overcharge. And it can ultimately lead to someone being removed from our list and not be allowed to be put back on it.
Any follow-up?
So as you know, I represent a very rural area. Do you feel that maybe some of those complaints are because they see maybe THP with the towing in an urban area versus a rural area? Because some of the fees that I've seen in my area were a little bit higher than maybe say Knoxville or one of those more metropolitan areas.
You're recognized.
I don't really want to speculate. If you've got specific examples, we'd be more than happy to look at that. But there are so many factors that go into assessment of fees, the vehicle, where they're located, how long it takes to clear it, that it'd be wrong for us to speculate on that.
Yes, sir. Thank you. Seeing no other questions, we get a motion for a positive recommendation? Oh, I'm public comment. I'm not going to get this today. Do we have any public comment? Seeing none. All right. So we've got a motion for a positive recommendation. We've got a second. Madam Clerk, if you would, please take the vote in the Senate.
Senator Bowling? Senator Bowling votes aye. Senator Crowe? Senator Hatcher? Senator Hatcher votes aye. Senator Oliver? Senator Oliver votes aye. Senator Kyle? I couldn't hear it. Senator Kyle? Aye. Okay, thank you. Senator Rose? Senator Rose votes aye. Senator Seal? Senator Seal votes aye. Senator Sutherland? Chairman Jackson? Chairman Jackson votes aye. Chairman, you have 7 ayes.
Thank you for that. Members of the House, all those in favor indicate by saying aye. Any opposed? If you want to make your no record with the clerk. The ayes have it. The rule moves out with positive recommendation. Item number 9. Also, Department of Safety. When you are ready, you know how it works, unfortunately. Introduce yourself again and tell us how the rules go.
Good afternoon, Chairman, committee members. Graham Tudor, Director of Legislation with the Department of Safety and Homeland Security. With me is Elizabeth Stroker, General Counsel, and Major Travis Plotzer with the Tennessee Highway Patrol. Departments before you today with rules in response to Public Chapter 122 of 2023. This public chapter shifted the school bus specifications from the State Board of Education to the Department of Safety. Rule 1340-03-09 serves as a comprehensive guide for the usage of school buses in Tennessee. The minimum standards must meet the National School Transportation Specifications and Procedures, as well as the Tennessee Minimum School Addendum. Standards addendum. The addendum includes the requirements of a crossing control arm, a bus ID number to be displayed on the sides, rear, and front of the vehicles, and lettering to identify the fuel sources used in the school bus. The standards are consistent with what is already required for school buses in Tennessee. A rulemaking hearing was held on August 18th of 2025, and no public comments were received. Happy to answer any questions.
Thank you for that explanation. Members, any questions? Representative Renaud, you're recognized.
Thank you, Mr. Chairman. I'm hearing that there are some schools who use these 15-passenger vans for special needs kids. Is there any particular reason why those are removed from being able to be used?
You're recognized.
Elizabeth Stroker, General Counsel. So this is only relative to 16 or more, including the driver, and I believe those vehicles are smaller.
That's true. Okay, so I just want to make sure what it said when it comes to what is said in here. It said that they were prohibited. So you're not prohibiting the use of 15-passenger vans.
You're recognized.
So, and I don't want to get it wrong, there was a bill passed last year that delineates between 15 and 16 passenger vans. And so they're not always considered commercial vehicles for purposes of licensing when it comes to 15 versus 16. And so I can't give you a definitive answer on the reasoning for why, but we're happy to get that information to you. You may have to chat with DOE to get that to you.
Okay.
Follow up?
Yep, I have another question. I received an email from a bus driver, owner of a bus driver, and he seems to have some concerns. I've had some longtime concerns about maybe some of the rules around buses, and that some of the technology that's being recommended, he's saying is really 15 to 20 years old, that there are many other more proactive things that could be recommended that would actually improve safety. I think this school bus crossing arm school bus crossing arm requirement, he feels like is probably less of a safety feature than maybe, say, requiring the buses to have lane assist or forward collision mitigation. So I'm just curious, who is consulted, regarding some of the rules for the safety on the bus? Because from the perspective of a lot of the contractors, the rules change. When the rules do change, they don't necessarily feel like they're not necessarily for safety. A lot of them they feel like are sort of random. They're expenses that they make that they don't feel actually improve bus safety.
Response?
So the additions are statutory. The General Assembly really has the purview of deciding what should and should not be on a school bus. And so, again, we sent this to any interested party. The school districts got it. The school bus drivers got it. None of those concerns were brought up to us. But I will say, when we're talking about adding things to school buses, a lot of the school buses out there, you can't retrofit with this type of equipment without seriously ruining the integrity of the bus just because it's older. So a lot of this equipment, could be required on newer buses, which are expensive. And that's probably why some of these things haven't been mandated. But generally, these additions in here are because of the General Assembly asking us to do so.
Okay, thank you.
Yes, ma'am. Any other questions? Seeing none. Any public comment? There you go. Thank you. Thank you very much. Appreciate it. We have a motion for a positive recommendation and a second. Madam Clerk, you would please take the vote in the Senate.
Senator Bowling. Senator Bowling votes aye. Senator Crowe. Senator Hatcher. Senator Hatcher votes aye. Senator Kyle. Senator Kyle votes aye. Senator Oliver. Senator Rose. Senator Rose votes aye. Senator Seal. Senator Seal votes aye. Senator Sutherland. Chairman Jackson. Chairman Jackson votes aye. Chairman, you have 6 ayes.
Thank you for that. And members in the House, all those in favor indicate by saying aye. Any opposed? Ayes have it. Rule moves out with positive recommendation. Thank you, guys.
Thank you.
All right. Next up, we've got item number 10, Department of Human Services. We appreciate your rush to the front there. When you're ready, please introduce yourself and tell us a little bit about your rules.
All righty. Good afternoon, everybody. I'm Callan Baggett with Department of Human Services. I'm joined by Paige Foster and Paul Helton with our department. Before you today, we have some rules that affect our Division of Rehabilitation Services, specifically dealing with our Tennessee Rehabilitation Center and Title IX compliance. These rules were filed as a new rulemaking on June 9th, 2025, and rulemaking hearings took place on August 4th, 2025, where no public comments were received. Below are just some highlights. Title IX rules apply to TRC Smyrna, which serves just roughly around 140 students this semester. Since any recipient of federal funding for educational programs and activities must have policies and procedures in place to be compliant with Title IX. TRC Smyrna, for those who don't know, is a wonderful facility that we'd love to host you at, dealing with adult learners with disabilities to build job skills, gain certifications, or achieve credentials that lead to employment success in the current labor market. The Title IX rules and policies include equitable treatment of those involved in an investigation, information regarding the reporting of sexual harassment, including reporting and supportive measures, the process of an investigation and its outcomes, including appeals, and a severability provision. With that, I'll be happy to take any questions.
Thank you for that explanation. Members, do we have any questions for our presenters? Seeing none, any public comment? Seeing none, Chairman Reedy, we have a motion for positive recommendation and a second. Madam Clerk, if you would please take the vote in the Senate.
Senator Bowling. Senator Bowling votes aye. Senator Crowe. Senator Hatcher. Senator Hatcher votes aye. Senator Kyle. Senator Oliver. Senator Rose. Senator Rose votes aye. Senator Seal. Senator Seal votes aye. Senator Sutherland. Chairman Jackson. Chairman Jackson votes aye. Chairman, you have 5 ayes.
Thank you for that. Members to the House, all those in favor indicate by saying aye. Any opposed? Ayes have it. Rule moves out with positive recommendation. Thank you guys for being here. Before we break, members, let's take just a second and recognize Miss Michaela Paris. She's been a wonderful help to us this year. Thank you for being here and joining us. And with that, do we have a motion to adjourn? We're adjourned.
Do we want to sing happy birthday to Julie? It's her birthday tomorrow.
Oh.